burası mobil olduğunda baş tarafında zaten geçiyoruz arada. Hadi ışıkları açabilir miyiz? Ameliyat ışıklarının fotoğrafları çekelim. Of medial crus, middle crus region, I mean little bit weak, and depends on stilling, there will be a little bit loss of rotation, and maybe we can use some grafts in here. That's all. Let's continue. And then I remove to the another side. And at this time, your nurse need to show you from alar cartilage region. In here, I need to little bit still in here, and try to show you in the midline, not in here, for better symmetry. This is important part of closed surgery. First one is this is a cartilage, this is a columellar region, okay, and there is a C point, and this is our cartilage. I wanna middle part of the C point little bit more front, here is little bit down position, and I wanna stay, my cartilage need to little bit oblique, not totally straight. That is why in here I take the septal cartilage only one time, and you can see in here this stitch is the backside position turning to this cartilage, and lower part little bit more front. In here lower part we plan little bit more front, here little bit more down. Try to achieve good C point region. This is the C stitch, this one C stitch, and lower part one foot plate stitches. And also at this time we will push inside of patient's nose tip, and we will decide everything is good, can I need to something else more or less, or symmetry is good or not. At this time this is important. You need to look at the backside positions of your patients. Try to achieve good symmetry. If you feel some part is longer or other part is lesser, you can think about some other options. I think our symmetry is good. Okay, we lost our connection several minutes. At this time, we did our right side. Okay. Wet and saw, osteotomies. Here is good. Okay. Şuradaki, this bone is too much convex, little bit I rasp this bone inside of tunnel. This is my tunnel, this is inside of my tunnel. Maybe, yes, as you can see, I mark in here with my hand saw. This is my osteotomy lines, and I did this with my burr. This is my hand saw, that's okay. And there is some lateral bone convexity, little bit I rasp lateral side bone, and then I complete osteotomy with burr. Evet.
Üşük.
That's enough. Little bit. Sometimes I cut. This it depends. It depends on deviation ratio. Sometimes I do scoring lower part of septum. Sometimes I cut or try to stitch to another side, or sometimes I use Vomer bone grafts. This is the Vomer. Vomer is a straight bone. This is our septum cartilage. If there will be deviations, sometimes I cut in here or bending, not totally separations. For example, in here some deviations. If we little bit bending in here to the other side, if we lost the connection in here and in here, there will be midline. This is first way. Second way, sometimes I remove triangular shape Vomerian bone in here. This is generally straight bone. I drill some holes in here, and I use undeviated side this bone, and I connected this bone to the other side septum. This is another way, but if there will be too much, there will be too much caudal part of septum deviation, sometimes we need to remove in here, and we need to totally separation with some extension grafts. We need to fix in here, sometimes spreader grafts, or sometimes unsabener grafts like this. As you know, we can do this. It depends, but generally, if there will be caudal part septum deviation, I bending and crush in here at the end of process, and I will stay midline level. I think everything is clean and good. Only right side, only I fill in here little bit step. Right side. Şimdi gelen arkadaş bize biraz radix grafti yapabilir mi? Diced cartilage. Şunu rim yaparız. These are my rim grafts. I feel little bit step right side in here, little bit I plan rasp, and then finished. And I bending to my lower turbinate, crush and use little bit. I rasp in here, I feel little bit step in here. That's okay. Haydi bakalım, bu da bitti. 3-0'la septum birikeyim. I use septal stitch for better healing process. 3.0 monocryl. This is septal stitch for protection of hematoma and better mucosal healing process and better columellar symmetry. I think this is very helpfully. And then I use Doyle nasal splints after the radiofrequency session. Kısaltalım biraz da. Little bit I feel some fullness in here.
Can you stitch the only cover or all
I am using to stitch to the caudal septum and posterior strut region.
just
Yes, posterior strut stitch and caudal septum, anterior nasal spine stitch I use always. What? Yes, I did mucosal stitches, both sides of mucosal stitches. In here, I did. I will close the intercartilaginous incision, not now, but I use intermucosal septum stitches also too. One caudal, one middle, as possible as more deep. I will try to use this kind of septal stitches. Tamam, 12 de güzel. And now I am using to radiofrequency surgery. This is radiofrequency salon system, especially tail of the lower turbinate. Radiofrequency, I use my every patients. 11 joule, 12 joule I use. You can see. Most important part of lower turbinate is a tail. Cause of always nasal obstructions, the reason of the nasal obstruction is tail hypertrophy. I use in here endoscope more. This is enough. And other side is the same, only I will try to show you. Bicotal speculum, radiofrequency is easier. Okay. And also I do medializations, lower turbinate, crush the bone for better airway passage. Perfectly. Here is good positions. And I am doing the at the end of my procedures, my longest cotal speculum and open in here. If there will be any deep deviations, I think this will be opening these deviations, longest one, and will be maybe a little bit inside outside osteotomy. I think this will be helpfully for better airway passage. Also middle turbinate will be open. I always open the airway passage with longest cotal. I am using Doyle nasal splint, only cut in here and frontal part. I will explain why I did like this. You can see in here, I want to opening this passage, airway passage to the side view, side. And stitches, please. Bir de 3-0 da alalım. I need to Hemitransfixion, mucosal incision lines. Öyle sığıyor, söylemedim ya. Diplerine gelin. Hadi bakalım, makası alayım. Gazlı bezle alayım. Bayanat seti de alayım. I use PDS tool in here because of after cut these two lines several days later. This will be more easier and more slight instead of monocryl stir. But please, you should always use stitch in this cotal, in this Doyle nasal splint region, because sometimes this splints will be backside positions. In the literature also there is a that case because of firstly when start using these materials, people do not use any stitch, only stay in the inside of nostrils, and there is some aspiration and some two different patients after the surgery at aspiration and this is horrible. Always you should use good stitch frontal part of the Doyle nasal splint. Islaklayalım tekrar. Bir dikiş daha atalım laterale. Yes, I will show you side position. And always you should decide to your symmetry, frontal side, frontal part, back, this part of your nose. And you should open your operation table this side. Always I'm going to do frontal part and look at the symmetry, nose tip and side view symmetry. This is important. Because of you cannot decide oblique view, is this good symmetry or not? Because of in human eyes has some perspective also too. When I look at something else in here, not totally straight, I feel one nostril is bigger than other one. Like a camera lenses, human eyes has also some perspectives. You should decide symmetry very straight. You should look at the totally front and you should look at the not like this. This is not important. Totally side view. And your table should be very straight. Okay, after my nurse prepare my cartilage, 5-0'ı da alayım ben. Şuraya da rim graftleri de koyalım. Onu hazırlayıncaya kadar ben şey alayım. Gri branül.
Bize bir tane verir misiniz? Bizi mi rahatsız ediyor? Ha, çok şey oldu.
Tamam, onu yani ayarlayalım, baskı yapmayacak şekilde. Bitiyor zaten. Ya belki en son bir dikiş daha bazen atıyoruz, bazen atmıyoruz. Hadi. Şunu da keselim. This is diced cartilage grafts. Everybody see?
Yes, we see, but we can't see the side position of the table.
Side position of the table, yes, I am here. But I will show you when I use diced cartilage grafts, I use in the radix region, in here. And little bit in here, a little bit more grafts I use in here. At the end of the process, maybe you will see better. Okay. Hadi içeri verelim. Below part of the skin, That is why I had for this patient, not every patient's tunnel. I use this one, radix region from the tunnel. This is for radix region, and another one I use up to bone. Because of, if you notice to my patient's side view, she had little bit deep radix and inward location bone in here. My nurse cut very thin cutting style diced cartilage for radix grafts and use little bit rifampicin injections for infection protections, and below part of skin I use these grafts. When I feel I need augmentations. With a tunnel technique, this would be very useful, but if I open very wide, this graft will go somewhere else. Nobody knows. Maybe in the Mallorca island or No Camp Stadium. Nobody knows.
Okay, we see.
Okay, we try to achieve flexible, good refinement, no stip, little bit supratip break. That is why I protection Pitangai ligament system in here for better supratip break. Try to achieve more natural nose ridge without any bone in here, and filling the radix region and supratip region. And this is very flexible. This is not perfectly, because of in this world, any rhinoplasty is totally perfectly. They said, I believe that. But I think this is not bad. Yes, and I will show you how I'm using to rim graft. With a grape cannula, I use general rim graft. This is rim region. I cut in here. And below top part of skin I feel. This is a tunnel. This is my rim scissor, very thin tip. Little bit I prepare the way of my rim grafts. That's enough. I prepare it to my rim graft, something else like this for better rim shape. This graft is helpful for better rim shape and other cartilage reinforcement, and I am using to another side.
Sorry, generally you use the rim graft?
Yes, very frequently. My mostly patients I am using to this kind of rim grafts. Because of after the procedures, several years later, depends on age. Then Torumi also mentioned about these topics. Human nostrils has some retractions. 20 years ago, maybe. And strong rim, I think, always better. Maybe this graft sometimes opening the nostril size, but depends on time, this would be not so important. And this would be more strong and sharp nostrils. This is better shape of nose, and also in the future some protections for alar retractions. Because of alar retractions for everybody is essential. Depends on age. Human nose is not loss only rotation, but also alar flare and nostrils become retractions after the 40, 45 years old. I think these grafts would be helpfully this kind of retraction. Sometimes I am using more long and more strong grafts, but for these patients I did. This is very easily in here. Can push inside, and also I stitch 600 monocryl sutures. This serum da alalım, onu ben şey yapayım buradaki serum.
Kısa da olur.
Ha, tamam.
Rakıt yok değil mi orada? Başka. Kaç var? Ulan bir tane alabilir miyiz? Eski.
Also, after the surgery, 6 days later, when I remove this Doyle splint and cast, I take my all patients' nostril size with a sizer, and I am giving to my every patient's nostril retainer 6 days later, 4 or 6 months period, nostril retainer. Depends on patient size. Before sleep time at night, they use this one, and also I show them some nostril symmetry massage techniques for better nostril symmetry. A couple of months later, if he or she feel nostrils is not too much symmetrically, with nostril retainer and massage also would be helpfully. And at night before sleep time, 4 or 6 nights per week would be very helpfully for better nostril symmetry. Because of after the rhinoplasty procedures, mostly patients come to you about their nostrils. Every patient, not every, but mostly of them come to me. Oh, doctor, my nostrils is not symmetrically, but in this world nobody is nostril totally symmetric. This is impossible. We try to achieve good harmony. Before the operation, I say to my every patient, my main aim is harmony, not geometrical symmetry. Some people fixed and some obsessions about symmetry, very famous authors say, do not undergone any rhinoplasty process, this symmetry obsessions people. Because of total symmetry in human base, impossible. And totally perfection in this world also
Çalıştırabilir miyiz?
impossible. Our main aim is harmony. There is some depends on our retractions, maybe the stress of liver surgery. So this is not important, but something else like this, always. Open or closed rhinoplasty or preservation technique, this is not only the aim is skin incision of columella, but also protection some scroll ligament or Pitangai system. This would be very helpfully because of for this patient we protected the Pitangai system, and I protected the scroll ligament complex, and I protected the skin in here. We can protections a lot of things. For your nose, we try to achieve little bit supratip break, and finally we will look at the down. I think this is not geometrical symmetry, but good harmony. Maybe I can use supratip break, little bit supratip break, little bit graft in here, but I am not sure because of we have some materials for these aims, little bit also in here. This is my cartilage crusher. Sometimes I crush cartilage and little bit more soft supratip break. These are like onlay grafts. I'm using the supratip region little bit, these crush cartilage grafts. Yes. Biraz daha yazayım şunu. Little bit more soft supratip break. Not so hard. I think would be good idea. And sivri uçlu de alayım. I'm using to all septum cartilage materials I try to use somewhere else. Because of very famous author in Istanbul name is Süreyya Şenel, they said about rhinoplasty is a camouflage surgery. You need to do good camouflage after the procedures for better results. Little bit more soft supratip break is good. And radix'e koyacağım. Bayonet penseti de alayım. Şunu da en son ve bitiyor. Evet, onu da alalım. And I used this grafts to the radix. These are only grafts. These are not structural grafts for camouflage. I will take before, yes, this finish my job. After surgery pictures, maybe I can do some collage. Tepe ışıklarını açalım, bir de fotoğraf çekelim. We are taking the pictures now, and then we call to second patients. This will be more quickly.
Thank you. Your help.
Yes, yes, I will. I will take my pictures now, and then we prepare to second cases. Maybe you can have a good lunch for you. I will stay in here.
Okay. Okay. Thank you.
Okay. By the way, from 11 blade, as you can see, only skin incisions, and I did 2 millimeter very thin osteotomes, transcutaneous osteotomy. Normally, I am not close in here. This is not necessary because of in this region there is too much stem cell. This transcutaneous incision lines will be very unnoticeable couple of days later. This is not needed to cut some stitches in here. 11 blade. Yes, with 11 blade tip I did only incision to the bone, and with this one 2 millimeter osteotomes, oblique style, not this style, oblique style. I cut transverse bone. We can open the totally wide dissection, but if I opened and without a nice tunnel, I haven't chance use some diced cartilage grafts, and this is not wide opening because of this is not complicated nose, but some patients we open more widely. Maybe our next patient I use differently, not more, little bit more opening would be better because of this young lady, one a natural nose, good refinement nose tip, slightly feminine curve, not deep curve. We try to achieve very close to her aims. In closed technique surgery, nose always talk with you. When you look at the nose, you can see is it needed little bit rotation, more projection, less projection. Whenever you do not cut the skin, you can decide which part of your nose needed or not. But if you cut with open technique and skin, you will see only at the end of process after finish last stitches. Yes, I use open technique also too, very frequently for revision and ethnic cases, but closed surgery patients, you can decide which part of nose needed something else or not. And this kind of eye drops, if you take your hospital, this would be very helpful in rhinoplasty procedures. protection for eyelash, artificial eyelash, and cornea and some eyes. Yes. Işıkları da açalım. And also I am using lower eyelids after the osteotomy, this one. This is not helpful for medical reason, but people will not see their bruising in here. She feel better. This is for camouflage. But little bit maybe helpfully protection for sunlight, little bit, but main aim for this patients, do not be stressful about bruising, something else. Hadi bakalım abi.
Bir saniye bekletsem hocam.
And 1 day later they will fly and come back to their country. And 1 week later at the shower they will remove the second tapings and cast. 6 days later I remove this one, and instead of this one I use more aesthetic another tapings and aluminium cast, more little than this one, and then with second one they can fly. At the end of procedures, I squeeze little bit in here. If there will be any aspiratör var mı?
Var.
Inside of nose, blood.